I'm going to start now, and I'd just like to first welcome everyone to this second webinar in our series across the year that we're going to do. Just like to introduce myself again for those that weren't on the previous one. My name's Douglas Hiscock, and I'm the Senior Product Manager at Silvercloud Health. And what we're going to try and look at today is building a business case for computerized CBT. Following the last webinar, I did have a couple of people ask me about this. So what we're going to try and do today is just walk you through some of the reasons why we need to have a business case, and obviously share some of my 10 years experience of working in IAP services and trying to give you a way of building those business cases. I've previously worked in the charity sector within IAPT and other areas, and I've also worked in NHS trusts, and I've worked in NHS England. And just firstly to say, just the business cases can be very complicated. They are sometimes very specific to organizations. So today I'm just trying to give you a taster of how we approach it within Silvercloud and how we work with our organization, the companies we help to build out their business cases as well. So just like to thank everyone for coming. Obviously, webinars, as some of you experienced at the beginning, can be a bit difficult for technical reasons. Hopefully everything will be okay. If there are any problems, if you just put say in the chat if the sound isn't working properly. We're gonna record this like we did last time, and then hopefully share it with you. So if there are any problems, we'll carry on recording and then send it out afterwards for people. The plan is for me to talk for 25 minutes, around about that time, depending on how quickly we get through the slides. And as we go along, if you can post questions, and then at the end, I can try and go through those questions and see if I can give you some further answers. Okay, so first of all, just really what is the goal of today's webinar? So these webinars, like I've just said, are going to happen every quarter. They're hopefully going to bring people together and try and share some ideas between us to how to make the IAP services better and how to make the Silvercloud product better as well. And really to share it as an open space for discussions. But as I've said previously, my role is to look at new developments and new ideas going on in the marketplace and seeing if we can build those new ideas for people to use. So today's one is about business cases. So what I'm planning to do is look at why there's a need, and specifically at this time as well, that there's a huge expansion going on, and we need to make sure that we're able to build the case for a digital solution going forward. So to do that, we're going to first of all start looking at what is the step 2 model, because obviously cCBT is designed for the step 2 group of patients that you're seeing all the time. And then what we're going to try and do is give you an idea of what that step 2 model does when you apply Silvercloud to it, and we'll use the experience from other services to just give you an idea of what they're experiencing and what kind of performance they're able to deliver. Then I'm going to look at a very simplistic way of doing a business case, just to give you an idea of how we would approach it, and then look at what that does for the service and how access improves. And then we're going to look at some what I call the intangibles, the things that we're discovering as we go along that add to the business case, and also just quickly, briefly go over the long-term conditions initiatives that are going on within IAPT at the moment, because obviously there's a huge amount of pressure for that to be the future of the business cases to bring money into IAPT services. So it'd be important to look at that as well. So the first thing to consider, and I've taken a very simplistic approach to the way we see the step 2 provision. So here we are, a normal step 2 profile at the moment from the NICE guidance is to see around 200 patients a year, to do in a week probably 10 to 12 assessments, and to offer between 20 to 30 clinical contacts a week. And that's generally delivered through telephone, face-to-face and groups. So this is a standard model, was previous to cCBT being offered, and also pre-Silvercloud. So obviously to build a business case, we have to understand what that basic model is. And then we have to look at what the Silvercloud offer does to the performance of step 2. And we are just going to specifically look at step 2 in these examples to make it much simpler. So what does Silvercloud offer to the platform to increase productivity? So the key for me, whenever I commissioned Silvercloud whilst I was working in IAP services, was the asynchronicity of the working. So what you're able to do is to work with far more people and be able to manage those people through the system. So obviously, because you're not working directly one-to-one with people as you would do in the traditional approach to therapy, you're able to see who it is who's struggling and who it is who's doing very well, and encourage them in a simplistic way through obviously through the review process that Silvercloud does to you. What that means is that people are able to get on the platform. It minimizes the impact of DNAs and cancellations, because obviously if you're reviewing people at a set time, you just quickly go through those people and see who's okay, who needs to be chased up. And it doesn't involve a huge amount of one-to-one work with individuals. The other part is the engagement part of Silvercloud. It allows people to rapidly access a program. So currently people are waiting for an assessment and waiting to be allocated into a treatment program, but with the ability to just send someone an email, get them going on the platform, they're able to access it much quicker. And this is quite important from my experience of working with people in the mild to moderate range, is that if you don't capture them quickly and enable them to get their treatment going quickly, then they tend to get disinterested and move away from the therapy. Long waiting lists for people with moderate conditions isn't the greatest way to engage people. The other part of it is because it's a program that's self-directed, you are able to pace it as you would want as an individual. So people are able to go in and do a huge amount, and we see people come in and they do the whole course really quickly. And then we see people dip in and out over a period of time. And this then means that it's much more in keeping with what people feel that they want to do. And when they feel highly motivated, they do a lot. When they feel low motivated, they move in and out. So that's quite good for people. The other part is that individuals are able to access when they want. So one of the things we used to experience in IAP services is that keeping people engaged for periods of time, especially 6 sessions at a regular time each week, can be a bit problematic, especially with people with complex lives who do shift work, who've got children. It can be a very difficult thing for people to come in every time and be available each week. So being able to access a treatment program when you want, when you're free, especially in the evening when you put the children to bed, is a great advantage. And in the end, what this leads to is engagement is at the center of the program. So the idea is that it's accessible when people want it and enables them to do the things that they need to do when they want to do it. So because of this, it's enabled services to really improve their productivity and to be able to increase the volumes going through that part of the program using Silvercloud through the Step 2 program. So what we've found within performance and services can be quite considerable. And here's one particular service that showed that approximately it costs, and this is another moot point where you can say that the cost of an individual worker, so a PWP costs around about 32k a year, and would see, as we said earlier, 200 patients in a year. And this is the lead service. So what they were able to do was to bring in Silvercloud and improve the number of people being seen to 355 clients a year through a PWP, through the asynchronous way that Silvercloud works. So what does this look like? This looks quite good. It means that the performance is much bigger and you're able to show that additional 150 people through each year. So again, it's quite impressive. But what does this mean in terms of the national standards and the objectives that services have to try and achieve over the next couple of years? So here we have the performance is shown, services are experiencing this. So how does this improve the performance of the services, and what kind of business case can you build following this to help build to the future. Now, one of the things that I'm very keen to do and look at is the next 5 years. We all know 5-year forward plan, it sets some very high targets, and here they are again. And so building the business case, people are going to have to find a way to grow their services and deliver a higher productivity over the next couple of years. So again, it's the 15%, 16.8, 19, 22, and 25. And one of the ways this is going to be done is by increasing staff. So building your business case to show how you can increase productivity is very important, because the projected for the next couple of years for the staffing is to go from 15%, which is about 7,680 people, up to 12,000 people by 2021. So this is the figure that's bounded around at the moment, which is an extra 4,200 people going into IAP services over the next 5 years to help build this. So what the figures? So I've taken a traditional view of how the workforce is going to be increased over the next 5 years, looking at 60% going into step 2, 100% going into HIW. And what is quite interesting is when you look at the numbers, it looks like there's going to be a considerable increase over the next couple of years. It is interesting that the 2021 is a lot less than 2020, so the real pain of increasing staff levels will be in 2020. Now, when you look at these numbers, you think, oh, that's lovely. I'm always a bit skeptical about what this will do, because as we know, the actual numbers that come into services isn't that high. And if you look at what's happened over the last 3 years in terms of the staff census, it clearly shows that PWPs and HIWs are not being recruited at the same level as probably needed. And so when you also factor in that PWP churn is about 25%, so every year we need more PWPs than actually what we're projecting to need by about 25%, it is a little bit concerning that going forward, step 2's come under more and more strain. And so building a business case is really important for this, because we need to make sure that we're getting the right number of people in and that they're able to work to the levels that they need to do to deliver the targets. So what I thought I could do now is just take you through a worked example, just to give you an idea of how we try and show the impact of having cCBT in services. So here we go. So over the next, I've taken just a random service, and I've used a prevalence around about 28,000 people, which shows that at 15% they need to see 4,200 people a year, and then at 16.8, 4,700, 19%, 5,300, and then up to 6,000, and then 7,000 in the final year. So the idea here is to look at the number of people that need to be seen, and then look at that number of people at step 2 that need to be seen, to see if you can increase the productivity and decrease the amount of money needed to get there, because it is going to be a challenge to recruit all of the trained staff, and we know that we're not going to recruit as many as we're going to need. So here we go. Here's the cumulative increase in step 2 services. So in year 1, up to 16.8, needed 302 people, and then to go from 15% to 19%. So this is a cumulative. So each year, so 672 would need to get from 15% to the right number, and then 1,176, and then 1,680. And anyone eagle-eyed here will see that this is different from the numbers. So HIW numbers have been taken out. This is just purely looking at the PWP numbers in the step 2 provision. So when we go back and consider that services are able to manage 350 people through using Silvercloud rather than 200, which is the standard model, what does this equate to in terms of number of staff that you will need? So then on the next slide, what I've been able to done is to run how many patients would be different between the standard model and with Silvercloud. So here in year 1, it's gone from needing 1.5 people to only needing 0.9 people. And then in year 2, 3.4 people rather than 2.1, and then 3.6 rather than 5.9, and then in the final year 5.2 compared to 8.4. So this is just showing you the impact of actually being able to increase the productivity when using SilverCloud. So in the next one, I've converted this into money, and using the leads model, which showed that it's about 32,000 for a PWP, which would give you this financial projection here. So I've also then taken the licenses that would be needed over those years to reach those models and divided it by the 4 years that you have. So you spread in the cost over the 4 years. And obviously you need around about 1,680 SilverCloud licenses. And so that comes to around about £40,000. And so in year one, there's a small amount of increase. In year two, the differential between the cost is greater. And over the whole 4 years, you'll be saving around £200,000, which is quite a substantial amount of money. And what also is interesting to look at, so that's building your business case going forward and using your projections, which is a great way to show people that if you invest this amount of money, you will get this return and you will reduce your costs and you'll need to invest this amount of money to deliver it. The other bit that is to be considered is when you consider the standard model against the model with SilverCloud and what the cost per case would be. So if you look at the individual cost per case, the standard model is around about 160, and obviously this can be done multitudes of different ways, and I'm more than happy to work with people to put this together if you would need some help. So the standard model is £160 in this business case, and compared to 98.46 when you have SilverCloud. Now, one of the things also to remember here is that it's important to remember that it's about maintaining the quality of the service, and this is the thing that SilverCloud isn't. We're not seeing this as a reduction in quality. And just to reassure everyone that our current quality standard, and we can see that as a recovery rate, is at 52% recovered and showing a 66% reliable change. So really, it's being able to increase the volume doesn't diminish the quality of what's being delivered, and you will maintain your recovery rate. This is in services with a high volume going through SilverCloud. So that's the kind of impact that you can have and the kind of business case that you can develop. And obviously I've done this in a very, very, trying to put it in a projection way so that you can see what it is, and we're more than happy to work with people on this. So that's a very simplistic approach. The other bit we wanted to talk to you about is there are some intangible additions to this, which we're beginning to bottom out and look at. One particular approach that is having considerable impact on services is we're being asked to produce a self-referral portal. So when people go onto websites, they're able to go onto the website, they go to the IAP service, they go through a portal, and they're able to start as long as they hit the right criteria for risk, and the services individually do this, and they set their criteria of what questions to be asked. People are able to start on the SilverCloud straight away and able to progress through the program and then are followed up afterwards. But what you're doing is you're capturing that moment, and that direct access, and here's a slide on that, is the people getting faster access to service. And one of the key things for people is when they feel motivated, especially with the mild end of the spectrum, is it's about capturing that moment. And having been able to go online and get going straight away and having 24-hour access 7 days a week has really helped some services with this. Obviously, we aren't able to find the exact impact of the cost of this yet, and we're building that as we go along because this is a new development and we have to wait for the data to come through to see what cost it will have. But there is potential now for people to go online, to do the treatment program, to get better, to get to recovery, and have very, very small impact in interaction with the staff. So people are able to get in there and be motivated to do their own thing and get out quite quickly, which is great for people. What we've begun to see is that there are a little bit of an indication of what what this impact is having. And one of the first things that we've noticed is there's a 98% increase when people are allowed to access the service directly. So there is, and throughout my experience, I've always noticed that you can have between 40 and 50, I think 40% people to 30% of people don't ever actually make it to an assessment. And that may be that they're are not have tried to access, and then because of the fact that they've had to wait a bit too long, have got disinterested and gone away again. So this is maybe a way of capturing the people who, when they feel motivated, they're able to get in there. And what we've been able to see at the moment is some of the indicative costs are it's £36,000 we've been able to save because 330 patients are able to access the service really quickly. And then obviously maintaining a recovery rate of 50% to 62% is a bit of a range going on with that. So this is one of the intangibles that we're beginning to build an understanding of how much we need to, how much this impact will have. And over the next 6 months, we'll be trying to show through business cases the impact that this is saving for services. The other thing to consider, and this is one of that is important at the moment, is the big push for LTC programs and being able to show, as it seems to indicate in the 5-year forward plan, that the funding for the expansion of IAP has to be found in supporting people with long-term conditions. And this has been quite an interesting challenge. I know that from working in services that working with people who don't see themselves as having mental health problems can be a very complicated group to get involved in, and being able to capture people through how they recognize their long-term conditions is critical in all of this. And one of the things that an advantage of an online service gives you is that we can tailor it far more in the way that the person perceives themselves rather than in them having to recognize that they have a mental health problem. So it's trying to make it more accessible and less stigmatizing and more tailored to the person's needs, and trying to capture the data. So what I know from looking at the data that needs to be captured for this group is that there are considerable numbers of questionnaires being developed, and so capturing information for people, especially around their impact on the health economy, can be quite complicated. And with an online system, you can capture those things in creative ways. And also being able to capture stuff is really important for your commissioners, because they will have to go away and build that business case with the people within their CCGs to ensure that their IAP service receives the funds that you're able to generate by helping people with long-term conditions. So one of the key things that we're looking at this year is being able to build out the long-term conditions programs so that they feel like they're far more tailored to the individuals coming forward, and also capturing people at the right time. So one of the things, just to say today how we can help in the future, is that we have put together a package for long-term conditions and for any kind of business case that you would like us to talk to you about, specifically offering the experience that we've had of working with multiple providers in different sectors with different issues that we can bring and help you develop your service a bit more. So specifically around the long-term conditions pathways is helping you identify the local need, working with you directly to see what bits of the service need help, what are the pinch points for the commissioners, where they got their pressures. Is it an A&E attendance? Is it COPD? Is it diabetes? And then helping build those relationships, working with the people for providing diabetes care to identify patients, and maybe using the online way of engaging with people. As you've seen previously, people are more likely, seem to be more likely to engage with therapy when it's online, because they're able to explore it themselves. And as we found, men seem to be engaging much more if they are able to sign themselves up through the web portal. So building those providers, then working, obviously doing some GP outreach, working with them to try and move in buy-in into the long-term conditions that you're trying to provide, and then work internally with your long-term conditions teams, if you have them, and with your therapists to see if we can make sure that we're capturing the data correctly for you. then obviously we're quite happy to work you to build your profile locally and help people see what you're offering, and work with you to build the collateral that gets sent out for partners and patients alike, to drive awareness, to help that with the recognizing needs, and using the online platform as a way of delivering that. And then also just to say that we also offer some training for supervisors to help improve the use of the digital packages, because that's one of the things we've noticed over the years, is that it's sometimes can be quite difficult for people to get their head around using the digital platform, and giving you the outcomes and reports that help you build that. And then working with accessing who is suitable for the service, who's the best people to go on it, who are going to get the most benefit out of using Silvercloud, and helping the staff and your local community identify those people so that they can get there quicker. And then offering training as we go along, and learning from each other, and building in training from other areas we found that work very well, and then bringing that into your services. And then again, trying to use the webinar as a way of bringing more people together to learn from each other and understand what's being offered. So overall, what we want to do is be able to show you that there are many ways of building in building a business case to help you make sure that you're able to get the right kind of services to your local community over the next couple of years, and also to offer our assistance in helping with that, and helping build the business case to get you as many staff in as possible. And just lastly, to just say thank you, and I hope that's been helpful. And I hope if you are interested in following up with us, we can send an email out to you individually to see afterwards, just to see if there's anything that we can help you with and build on the partnerships that we're developing. And just to say thank you very much for listening, and just say just to see if there are any questions that people have, and I will quickly just check on the questions that are on the system if there are any. And thank you very much for listening.